Namaste. Namaste. I'm Dr. Indra Jayakumar. I'm a pediatric intensivist and the lead at Apollo Cancer Hospital, Tenampet, Chennai. I look after the cancer and transplant kids and also the medical director of Apollo Shine Foundation. Apollo Shine Foundation is a not-for-profit student health initiative of Apollo Hospitals. It is spread across 10 cities in India. And what it offers, colorful first aid rooms with all emergency equipments to handle any emergencies for both staff as well as students, a well-trained nurse who is also certified in BLS and first aid. And we offer screening, we offer campus audits, we do awareness talks like this, and a lot more, anything for student, teachers, and the non-medical, non-teaching staff, anything for their health. And you can look at our website, Apollo Shine Foundation. So I'm very happy to have here Dr. Shreevidya. She is the head of the Apollo Group of Hospitals Preventive Health. And we are happy to have her here addressing everybody. They say we must be the change we want to see in the world. So we should take care of our health so that we can take care of others. And we should also know how to take care of the health of others. Now, what we are seeing during our screening is that many students are also having diabetes, hypertension, and other, they have metabolic syndromes, they're obese, and they could develop strokes and heart disease in future. So if we want to have future healthy citizens, we should start with our students, with ourselves, with our families, and our friends. So I will introduce Dr. Shreevidya. She has a very illustrative career. She's a dynamic internist, a diabetologist, and a women's health specialist with 2 decades of experience in preventive health and women wellness. She played a pivotal role in the COVID-19 response and was involved in all the crucial pandemic initiatives. She is an alumni of the Mahatma Gandhi Institute of Medical Sciences. She's worked at Apollo Hospitals, MGM Healthcare, Adyar Cancer Institute, and other colleges. She also, I know, has got a very vibrant professional and a non-professional life. She's a health freak. She goes Himalaya camping, base camping. Yeah, and I think a lot more. So I think we should learn to live our life to the fullest, like Dr. Shreevidya, both professionally and personally, and challenge ourselves. So I want you to talk a little about your non-professional life as well and how you keep fit and how you enjoy nature. Okay, over to you, Dr. Shreevidya. And thank you so much for accepting Apollo Shine Foundation's invite.
Thank you very much, Indra. And it's always very, very heartwarming to talk to parents and people at large. I love talking. That is one of my biggest personality trait, I think I should say. I'm a physician by profession. I've been a physician for the last 22, 23 years since I finished my postgraduate and moved to Chennai. Being physically fit is something which is, as a person, I crave for, because I do not want to be mentally and physically and emotionally dependent on anybody. And we should always ensure that whatever we are earning, we need to use the resource in the right way. And falling sick is depletion of our resources. So I evolved from being a student, a doctor, and then from a mother, a doctor again, and then a medical director now. And I think the one thing which, as we become bigger and busier, is that we shouldn't forget ourselves. So quickly, I'll go through some of the pointers which we have put together for you today. And after that, we are open to all the questions. Shalini, I can share my screen.
Sure, doctor. Yes,
Um,
Shreevidya.
yeah.
Yeah.
Yes, I'm going to share my screen. Is my PPT visible? I'm just going to put it on.
Yes, doctor, it's visible.
Yes. So let's talk about why we need to have a certain health choices. This is not mandatory, but it is just one of the ways which will pave our health. And it is always important to be better informed. In today's time, where media accessibility, digitalization, easy information is so much rampant. We consider WhatsApp and Google as our physicians or as our science informant. So let us just understand what impacts our life, and there are some very easy solution to this. So what is definition of lifestyle? Is just one second. Yeah, is it's also known as non-communicable diseases because diseases are two. One is something which gets communicated from patient people to people, with like viral infection, cough, cold, and all. And then there are these set of non-communicable which does not get communicated. It does not go from one person to other, but either it is genetically inherited or it is our lifestyle issue. It can also be as simple as a bad sleep. It can be as worse as an addiction. So, what are the causes of lifestyle diseases? Poor diet, lack of physical activity, stress, addictive habits, high, what to say, consumption of alcohol, smoking, and of course, the ever increasing environmental pollution, right? Why does it impact life? It decreases the life expectancy. Even if your expectancy is longer, that means we live longer, but the quality of life is not that good. Like I said, it's a financial stress on any individual, and many individual together make a community. So it is a burden on the healthcare system, on the community, on the nation. It impacts productivity and societal well-being. You want to attend a wedding, but you fall sick frequently. You want to go for a vacation and you don't know whether you want to, I mean, you're going to fall sick. You want to participate in a marathon or a trek, but then you don't want to check what is happening to you before because you're scared of finding out what is going to come out of it. So the denial and scare itself stops you from having a good lifestyle. So, what are the common lifestyle diseases? You have obesity, diabetes, hypertension, cholesterol. So, everybody knows that. We also know that there are heart attacks. What we don't realize that a lot of these cancers, breast cancer, colon cancer, are related to lifestyle diseases. Obesity, increasing asthma. We don't even diagnose asthma anymore. And the not talked taboo subject in our society is mental health diseases, where going to a psychiatrist or a psychologist is considered as a, oh my god, he is mad or he is crazy. So he or she, I'm sorry. So mental health disease is a non-communicable disease also. So let's quickly look at obesity. So there are 3 4 parameters. So we all know weight is a problem, a challenge. It is not about body shaming, it is not about trying to look good, but it is about being healthy. Looking good comes automatically. Your hair improves, your skin improves because you're taking away this huge challenge of inflammation in your body because you are overweight. So, BMI is one parameter. We also look at waist hip ratio. We also look at waist height ratio. So, these are a couple of parameters which will tell whether you are in the right range or not. For Indians and Asians, certain dynamic numbers have changed. We no longer work with the global numbers. So underweight is remains the same. The normal BMI for everybody other than Asian is 18.5 to 24.9. But for Indian, normal is less than 22.9. Why? Because between this 22 to 24 also we found a lot of people developing heart disease, diabetes, hypertension. Overweight is 25 to 29.9. For Indians, it is 23 to 24.9. And anything above 25 kg per meter square is overweight or is obese. It's not even overweight, it is obese. Diabetes, again, we need to come out of this denial mode. It is high sugar. And it, even if you do not have a family history of diabetes, the fact that you're obese, the fact that you're sedentary, your sugars are going to keep spiking up here and there. Accepting that we live in a genetically programmed nation for diabetes, we cannot run away from sugar problems. Hypertension, it used to be 10 years back, 10 or 15 years back, 1 in every 10 people had hypertension. Then it became 3 in every 10 person is having hypertension. And the latest says it's almost 7 in every 10 have got hypertension. Not only adult, we are seeing this diabetes and hypertension trickling to the age group where we don't even want to think of these diseases, and that is in our teenagers. Between the age of 12 to 18, we found that there is undetected diabetes, hypertension, and of course, obesity we see in our children anyways. So what is a normal blood pressure? 120/80, full stop. 130 up to 130 or 139 by 85, we consider it as normal range, but it cannot be 140/90 always, and it is acceptable. No, it's not. Cholesterol or dyslipidemia, it is abnormal lipid level of lipids or fats in the blood. Eating poor cholesterol diet or high cholesterol diet adds to the problem. This is genetic. So, it is important to understand that these are dissolved fats in our body. It is also coming from the accumulated fat below our skin. Lung cancer, smoking is being one of the biggest cause, but let me tell you that there is no family history in lung cancer. There is no detectable genetic testing which will tell that there is family history or there is a prediction to lung cancer. But we find that pollution, some women and asymptomatic people, maybe because of pollution or lifestyle changes or because of secondary smoking, passive smoking, are also picking up lung cancer. Colorectal cancer is again a sedentary lifestyle, poor eating habit, very high diet high in red and processed meat, as well as low in fiber, are linked to the increased risk of colorectal cancer. Liver cancer, you have viral, you have alcohol, which causes cirrhosis and then causes liver cancer. We also have uh, multiple causes of fatty liver, which is causing liver cancer. But hepatitis B, C remains one of the biggest cause of liver cancer, Hep C specifically. Skin cancer, overexposure to ultraviolet radiation, use of unapproved, unvalidated skin products, which takes away the good microbiome from your skin, also predisposes us to develop skin malignancy. Breast cancer, again, we only think that anybody who has a family history of breast cancer should be screened. Even there, the fear of knowing that you are going to be you're going to pick a breast cancer, stops women from screening or getting a mammogram done, because we associate breast with being a woman. And I think that is one of the biggest challenge today. A woman is from the heart. She is from being a mother. It does not have anything to do with breast. Men also develop breast cancer. It is not known, but it is not talked about. So breast cancer, anybody who is obese, who has addictive habits, lack of physical obesity, live in a very stressful environment, are prone for breast cancer also. Stomach cancer, vegetarians are as susceptible to stomach cancer as are non-vegetarian, again because of processed food, because of low fiber diet, and of course there is a very, very strong genetic history here, family history here. Chronic obstructive pulmonary disease, what we used to be calling bronchitis or emphysema, have all been clubbed into one particular group, and it is added to by smoking, by pollution, occupational dust and chemical. Asthma, which is like a childhood asthma, if left untreated or undetected, flares up in adulthood also. And that's also part of COPD. Mental health diseases, depression and anxiety is very common. It is present in each one of us. How do we handle it? Where is the balance? How do you swing it is the most important thing. to know, basically, right? So how do we prevent this? I mean, it is very distressing or very demoralizing to know, oh my God, there are so many of them here. But okay, let us start with simple. I need to have a healthy diet and nutrition. What does that mean? I need to ensure that I have a vegetable based diet. I am eating a lot of greens in my every meal, not on Tuesdays and Fridays. In typical South Indian, chevva velli, avladhan, appadi illa. You need to have a fiber, whether it is cucumber or spinach or beans, in every meal, 3 meals a day, 21 meals a week minimum. And hydration, drink enough water, avoid processed food, ensure that there is adequate protein in again every meal. Dal and pulses are not protein. Regular physical activity, try to get in between 7,000 to 10,000 steps a day. Do some stretch exercise along with it. Learn what is your stress, which is your stress point, and try to address it. Avoidance of tobacco and excessive alcohol. Even one sip of alcohol is bad for your gut health, but you need to drink or use it judiciously. But tobacco is a total no-no. And get checked. Talk to your doctors. Find out what are the red herrings, what are the flags in your lifestyle. Like I said about nutrition, it refers to the process by which organisms obtain and utilize nutrients from the food to support growth, repair tissue, maintain physiological functions, provide energy for metabolic activity. And that activity can be as simple as hair growth to ovulation and childbirth. Food pyramid, we no longer use this, but just to give a very, very basic idea, you need to include lot of cereals, legumes, consume adequately, avoid going up to processed food, eat very sparingly. But basically, the middle tier is more important now. Eat protein. You need to have protein in your diet and adequate fruits and vegetable in your diet. So this is more wholesome. Like I said, protein and vegetable. Fruits need to be consumed as and when your physical activity allows you in the form of fruit itself and not juice, and adequate hydration. Very, 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 very important. Okay. So what is the benefit of healthy eating? Overall health, improved weight management, better energy level, better bowel movement, immune system supports you, heart is healthy, skin is healthy. You take care of your nutritional B1, B12, folic acid deficiencies. When the body is healthy, the brain stabilizes also, and there is longevity. Common nutritional pitfalls: overconsumption of processed foods because they are easily available, they are faster, excessive sugar intake, low fruits and veggies, not hydrating enough, skipping meal. Even the intermittent fasting needs to be done well planned. Fat diets and restrictive eating, ignoring portion size, alcohol consumption, and lack of meal planning and preparation. What is the importance of hydration? Not only we need it to regulate our body temperature, it hydrates your brain, improves your cognitive function, it supports digestion, flushes the toxin, makes the joints more smooth, more lubricant, skin becomes glowing, improves mood and energy, and prevents hydration. Physical activity, anything which works for you, minimum 30 to 45 minutes a day, 5 days in a week, and it can be whatever you like. Don't start suddenly, start slow and sustainable. Sleep is very important. You need to have a good nighttime routine, wake up at the same time, have a healthy sleep environment, avoid screen at least 2 hours before sleeping, exercise, reduce stress, and avoid huge meal and caffeine before sleeping. Stress management, very simple rule of 888. 8 hours of work, 8 hours of self care, and 8 hours of peaceful sleep. In the self care, you need to have, you need to ensure that you are loving yourself first, take care of your health and hygiene, and then family and friends and faith. whatever way works for you. But you need to identify what is the stress. Stress is not going to go away from our life. It is important to identify and manage it. So quit smoking, set a quit date, identify the triggers, create a quit plan, build a support system, change your routine. Avoid people and friends who are smoking, because even passive smoking is bad for you. And celebrate every milestone. Take help when needed. Stay busy, stay positive. So, what are the, uh, you know, how do we need to address this? If there is something which is kind of telling you that something is not right, go and talk to a professional. Find out what are your risks. Asymptomatic, that means there is no symptom right now, does not mean that there is no underlying problem. You may be fit, but you may not be healthy. So, two different things. Being fit and being healthy. You may be healthy, but you may not be fit. It needs to go parallel to have a good life. So, identify the risk. Early diagnosis means no complication. Next step is, even if you diagnose late, it is important to ensure to prevent complication, to ensure that you have a good quality of life. Whatever life we have, we need to be mobile, pain free, and able to have a good sleep every day. So, creating healthy habits, set realistic goals. I'm going to lose 10 kg or 20 kg in a year, does not work. I'm going to lose 1 kg this month. The next month, I'm going to maintain this 1 kg and then lose the next kg. Routine is boring, but that is what gets you the sustainable outcome. Find healthy recipe. Don't go on fad diets. Meal planning for a busy lifestyle is very, very important. Mindful eating, 80-20, there is always a percentage called as an 80-20. 80% of the time you need to eat healthy, so that you can cheat 20% of the time, and even in that 20% of the time you need to ensure that you are eating healthier. Overcome your challenges. Talk to somebody who can help you overcome your challenges. For example, if you're not able to set time or take out time, or feel bored going for a walk alone, get a walking buddy. Get a dog. A dog is a very good walking buddy. And enjoy, find which physical activity you like. It can be cycling, skipping, running, walking, water, dancing, swimming, whatever works. Find that physical activity which you will definitely enjoy. So, what are the take home messages? It's never too late. I have a 65-year-old aunt. I'm so proud of her. She's been diabetic probably since the age of 40. Struggled. I mean, we used to have a big fight at home. But this lady has changed her life by reversing her diabetes, and she is part of a very big hard workout agency called as Quad. I mean, at the age of 65, she joined a high intensity workout and she's pushing and pulling weights. So, really, really, so it's never too late. Eating healthy is a choice. It should not be an option. It is your choice to eat healthy. Be active, be hydrated, drink water, be mindful, and love yourself. Very, very important is to be self compassionate. Thank you very much.
Hi, Shreevidya. That was
Yes.
wonderful. It was so simple. I expected you to take off a little. It was very, very simple and so basic and yet very complete. I just have a question before, and I want the others also to interact. You can type your questions in the chat box, or even, unmute and show your video and ask these questions. What about crash diet? Now, everybody, you also mentioned intermittent fasting has to be done well. So a little, could you enlighten the others on the good and the bad?
See,
Mm.
any diet program um, needs to be sustainable to have lifelong benefit. Any habit change to start, at least take 3 weeks to get into our system, to remember that, oh, we are making a habit change. So for 3 weeks, it is, so we call it like saying, to change habit, it takes 3 weeks. To make it sustainable, to show outcome, it takes 6 weeks. And to have lifelong benefit, it takes 6 months. So any crash diet which does not include nutritional deficiency, addressing the nutritional deficiency, is not going to be helpful. There are a lot of diets like paleo, keto. Each of these diets were designed for a certain purpose. For example, keto diet was technically started for autistic and hyperactive children because we wanted to give them more protein for sustainable energy rather than they have carbohydrates. So they removed carb totally from their diet and gave them only protein. It helps to a certain extent, but what happens is that you start developing craving. If your diet does not address cravings, you will find that end of 3 weeks, you are not able to sustain a diet. So any diet needs to be vetted out for craving, for energy source, per calorie meal, what it is, and to give it a trial period of 3 weeks, whether to find out it's going to be sustainable or not.
Shreevidya, another question. You did mention protein, right? So what do you, for vegetarians, I mean, non-vegetarians, you have your chicken and all, and that is good protein source. But tell me for vegetarians, what are the healthy proteins and how much protein? Because now people junk on, they are actually taking too much of protein powders. So could you just
So
share your, yes.
there's no such thing as too much of protein powder. So I'll tell you what, this is how it works. We need to have 0.8 to 1 gram per kg body weight of protein every day. So in our meal, there has to be carbs, there has to be protein, and there has to be fat. The fat comes from the little bit of oil which we take. It cannot be fried and all. But the protein, like Dr. Indra said, there is vegetarian and the plant source and the animal source. From the animal, you have chicken and fish, which are white meat and they are lean meat. We do not advise red meat like beef and mutton. Pork maybe sometime, but not sustainable again. And it's very expensive. So these, and eggs, of course. So these are good source of protein for the simple reason that these three proteins have got all the essential amino acid, especially egg has all the essential amino acid. One egg has approximately 8 grams of protein. The white has 6 and the yellow has 2. Somebody who has cholesterol can take 3 egg white and 1 yellow as a standard breakfast or any meal for that matter. So we need to have out of that 0.8 gram per kg body weight, if you are say 80 kg, so you need to have 80 grams of protein per day, 20, 20, 20 in each meal, and the rest of the 20 goes as multiple snack. So it can be a cheese cube or it can be a protein powder supplement. Most of these protein powder supplements have anything ranging from 8 to 10 grams per scoop to up to 24 to 30 grams, uh, depending upon the bioavailability. I have a little doubt about this 24 to 30 grams, how much of the protein is actually bioavailable. But let us take it that at least 10 to 12 grams of protein is bioavailable in every scoop. So to compensate for the rest 20 gram, you will need to have 2 rounds of these protein. So there is no such thing as excessive protein because Indians, because of our excessive diabetes and poor eating habit, we are actually protein depleted right now. We are what we call as sarcopenic. So even if somebody is thin, they are thin obese because they do not have adequate protein in their diet. So you need to ensure this is something which this is where the meal preparation goes. You need to count it. So what are the good source of vegetarian protein? The vegetarian protein, you have paneer and you have soya. So the popular belief that soya cannot be taken because of ovarian and thyroid cancer. People who have thyroid cancer should not take soya. And the amount of soya which we are taking is so less, it does not really count. So you need to take soya protein or anything, but you have to mix it with two more things. One is adequate fiber and other is water. So you do not let any toxin accumulate in your body. please ensure that you have at least 300 grams of fiber or vegetable with every meal. So then it becomes a full meal. There is carbohydrate in all these things. So you are never going to be on a zero carb diet. You may not be taking sugar, but it will never be zero carb. So protein, 5 good proteins which will help us is egg, chicken, fish, soya, paneer, tofu and paneer, whichever works for you. And then you can always, so the protein are also extracted. The protein supplements are also extracted from either milk whey or from pea protein. There is some rice bran. I'm not really sure how good it is. And then from soy. So you can have either of these, whichever works for you, or you can have a mix. You can add this protein powder to anything you are taking. You can add it to your curd. You can add it to your kutu. You can add it to your dal, anything. Because if it is flavorless, it works. Flavored ones, you'll have to just mix it in water and drink it then. Any
Doctor,
question?
there is a question from a participant. Their HbA1c is high. So, what changes would you recommend in addition to diet and exercise?
So when the HbA1c is high, anything up to 7 is on diet. So the first thing when we say HbA1c high means they are diabetic. So no sugar. When you say no sugar, no white sugar, no brown sugar, no jaggery, no honey, no juice, no karipatti, no palm sugar. Everything is sugar, no sugar. The minute you cut down the sugar, your sugar starts going down. But what happens? Your body starts craving for more food. So you need to bring in the proteins there. Of course, you may also, depending if your A1C is up between 7 and 9, you will have to take the sugar medication and go on a diet. Try to bring it down to less than 7 and maybe slowly bring down your medication. Diabetes is reversible up to 9. We can bring down diabetes and you can be on a good diet lifelong. But remember, diabetes reversal only works till your pancreas are supporting you, till you are on a good diet, and be kind to yourself. Please don't go on the advertisements, for there are so many of these diabetes reversal program which says once you are reversed, you are there. No, diabetes is reversed only till you want it to be reversed. So above 9 to 11 A1C, tablets, that is OHAs, we call is oral medication plus insulin. Above 11, it is essentially insulin. So you need to do diet, you need to exercise, but it will be under the supervision of a doctor. Why do I say dals are not a good source of protein? 1 cup of dal, okay, has around 300 calories, around 20 grams of protein, which are not bioavailable, 24 grams or 36 grams. But then there is around 50 grams of carbs also in it, which is very, very easily bioavailable. So whenever, say for example, if you have to take 20 grams of protein per meal, you will probably get 3 or 4 grams of protein from that 1 cup of dal. Try to imagine how much they have to, you will have to take to get that 20 grams of protein. Maybe you'll have to take around 1 kg, around 23, yeah, around 1 kg, 1 kg every meal. Yeah. So is protein powder recommended in children? See, the children weight is less. So if you go by that, egg, paneer, tofu, whatever diet, some dal, yes. And the protein powder, if they are into high intensity sport, depending on how they are, and it can be given. So there are a lot of these good single isolate protein powders for children, which can be definitely used, but source it out from the diet. That is more, really, really more important. For how many?
Shreevidya, Bonvita, Horlicks,
Oh,
and
they're all high sugar, high malt. It's got corn syrup. Horlicks is absolute. All these flavored sugars and all, they do not have any nutritive value except for calorie and carbs. So I rather you give them a glass of milk with maybe a little bit of egg in it or a protein powder in it, or things like that. You can give them cheese cubes. Cheese cubes are better than cheese slice. Mm, yeah, soya chunks really works very well. What I suggest is that any of these soya chunks, you get mini nuggets. You can make it into like a popcorn, dry fry it, or you can put it in the kebab or in the kutu. So vegetable. So it becomes like part of the protein itself, then part of the meal itself rather. How many
Cereal,
hours can we? Sorry, yes, Indra.
sorry, cereals. A note on cereals. The good and the bad, because a lot of them have sugar as well, right?
Everything is sugar coated. So there is muesli,
Mm.
only muesli with some dry nuts. With then again, you still have to add a protein to it because it's just a source of carbs. Dry fruits are a total no-no because they are very, very concentrated in sugar. Anything which is dried is rich in carbohydrate, very, very rich in. So, for example, even khakra. Khakra is dehydrated chapati, and it is only carbs there. So we love our khakras, but khakra is full carbs. There's nothing in that. So
Oh no.
anything, yeah, anything which is dried apricot, prunes, everything is carbs, maybe a little bit of fiber, and that's about it. So when somebody says smoothies, I ask what is in that smoothie. If you're putting spinach, if you're putting the berries, gooseberry maybe, and then add a protein powder to it, then it makes sense. But also, it is for people, see, this works for people who are already very physically active and they want an instant energy. It does not work for somebody who's trying to do a weight management, thinking that they are eating good, but they do not get adequate calories out of it. And then they are hungry. Then it will not work because they are craving. So we're not addressing that craving in diabetics. We're not addressing the food requirement, the calorie requirement of that person who's trying to lose weight. So adequate protein, measured, planned, prepared is one of the best way. The amount of good sleep, the amount of energy level one gets with a properly planned diet is amazing. Somebody asked about intermittent fasting is a very, very big challenge. So the best way is to do a 12-12 to start with and then go to 16-8. And it is important that you choose the 8 hours or the 12 hours to eat where you are maximum active, not when you are going to be sleeping. So there is 12-12 and there is 16-8, and the rest all the six thing doesn't 6-16 does not really work for us. So 16-8 is the most popular. That means you eat 8 hours and you do not eat for 16 hours. That is what I mean by 16 and 8. Shalini, there are too many questions. Can you keep track of the question? Somebody is asking, I'm not very good at taking enough fruit, although I try. Is it okay to take multivitamin daily? Yes. Fruits also have a lot of carbs. Fruit is good for energy source, especially if you're going for a workout. You can have an apple and go, but they do not have all the nutrient in it, but you can take multivitamins. So supplementation is not bad. Any supplementation which is not working for your body or it is excessive will go out in your urine. So it is garbage in, garbage out if it does not need it. I think my immunity has become better after study. Yeah, please continue. That's fine. I'm a vegetarian. I feel like that today's session, or should I? Please, eggs. Start with eggs as a protein source. Very good. And if it is okay with you, you can definitely do a fish and a chicken also. Ma'am, can you tell us one diet food that we can follow? I do not believe in brands. You can choose what works for your pocket, meet your dietitian, and see, like I told you, it is important that we need to calculate what protein and fiber. If you're able to calculate the 20 grams of protein, so say 100 grams of paneer will have 20 grams. Soya, 50 grams will have around 10 grams. Egg, I have already told you. So 100 grams of chicken has around 20 to 30 grams of protein. You need to do that calculation. It's very easily available. Can we take smoothie for a breakfast? You can, but then you need to ensure that you're having that much fiber. I would suggest even if you're having a smoothie, the smoothie should be protein based and you should have a bowl of cucumber along with it. It's really very, very good to have a lot of green and fiber. Can I consume all my protein in a single meal? Very bad idea. Your bowel will not be able to tolerate 80 grams of protein in one shot. You will be either constipated for days or you will be having loose motion. It is always better to split it into 3-4 meals and take it. You cannot take 10 eggs in one meal. I mean, it's as simple as that. No, 10 eggs for an 80 gram is 80, for 80 kg is 80 gram. Greek yogurt is a very good source of protein. 100 grams of Greek yogurt has approximately 4 grams of protein. It's a very good snack. It's a very good snack. Can you suggest for breakfast for kids, eggs? You can give them oats, the roller cut, the whole oats, along with some vegetable and gooseberry. Kids need also equal amounts of carb and fiber. Avoid processed. I think the most important part of our diet is that we should avoid processed food like maida, buns, burgers, Maggie. So there is no 2 minute which has got a diet, which has got a nutrition in it. So some of the thing, encourage them to eat curd and yogurt because it's a lot of pre and probiotic. It is very important for our gut health to be important, to be healthy. Gut health is what steers our brain health. If our gut is healthy, we are at rest. So we need to address whatever is it. Gut health does not necessarily mean only constipation and loose motions or normal bowel. It also means your level of energy. It also means your skin. It also means your memory. It means your cognitive function. So it's very, very important to have a good gut health. Yes, peanut butter is an amazing source of protein as long as you are able to tolerate peanut. A lot of people have peanut allergy. So it is very important. Peanut is very good. Which protein powder, Dr. Rindra, which protein powder should we give to the kids? There's something really I've not thought about because I'm an other physician. But I think there are a couple of good brands. Learn to read the label, which says 100 grams. One scoop has 8 grams. There are a lot of brands. I really don't want to name any brands here, but there are some really good brands like Origin, OMG Labs, Panchamrit, but the taste is like not really very good. Even Amway Neutralite is not bad. What else is
Amul
Amul has both. So Amul has protein rich buttermilk also, and Amul has the powder also. Yeah, but the Amul powder is pure whey. And if somebody has lactose intolerance, you need to be a little careful. But please mix it with fiber and buttermilk should be okay. So I mean there are a lot of this brand, but please don't go by don't buy too much. Always go for the smaller ones. Try it out for some time. Ask your friend if they are using. Try it out for some times, and then you can do it. Start in small portion, but still, if we are not hurting anybody's religious sentiment, egg is really one of the best source of protein. Paneer, tofu, I think you are set. South Indian food, everything is dal based. Yeah, we all think dals are good source. Like I said, 100 grams of any dal, you take any dal, does not have more than 3 to 4 grams of active protein. Groundnut oil, no. I personally prefer ghee and coconut oil. We do not need the concept of using polyunsaturated fatty acid is not there anymore. So we need something which is improving for your gut health, what we call a small chain fatty acid. So groundnut oil and coconut and ghee is very good in smaller amount. Anything in small amount. Yeah. Breakfast bars. I use any of this as a person who does a lot of travel. I always keep a good breakfast bar with me because it gives me this instant energy so that I don't get craving and then I don't go into grabbing whatever is available. I also keep cheese with me. I keep these protein powder shakes. So yes, breakfast bar works, but they are not to be used as a meal. They are only as a snack. Children are taking only fruit as breakfast. Fruits are only carbs and little bit of fiber. See, remember something. Fruit is a ripe vegetable. Whatever that vegetable has nutrition, by the time it ripens, only sugar and flavor is left in that, or some little bit of vitamin C maybe. So, like, how good are millets? So, you need to remember something about millets. They need to be organic, or how should I say, they need to be unpolished, and unpolished millets are difficult to cook. Even there, diabetics, they take millets thinking as much as rice they can eat, their sugars go up. So millet also in small proportion, brown rice in small portion. I think it's not a big deal when you, so 3 days a week for somebody who is trying to lose weight, you can add a grain, 100 grams of grain, and it can be any grain. It doesn't have to be expensive at all. I do not believe in spirulina. I have no comments on that. I don't know what is there in spirulina at all. So no, anything which is over the counter, which does not have a science behind it, we cannot tell what ingredients are there, I rather not take it. It may not have any side effect, but we don't even know what effect it is giving. What are the long-term benefit and long-term issues with any of these pills? I don't know. That's why I'm not really very comfortable in about a lot many of these alternate supplements. I really do. We do not know what is the ingredient. A lot many of them end up having liver failure and kidney failure. So we really don't know.
So
During
what
the
about collagen, Shreevidya?
collagen is natural. Yes, collagen is good. But let us be very frank here. Collagen without protein and physical activity is useless. Where should the collagen go? It needs to go and strengthen your muscle. It needs to go and strengthen your ligament. So collagen is good, but without protein, collagen or any supplement is a waste, because protein is the binder. Protein is your genetic, it's your gene, what to say, basis. If you're not going to take enough protein, then collagen or any supplement is going to be a total waste. You can take collagen, but why? Some people who have got autoimmune diseases, people who have arthritis, you specifically, we need to kind of take that. Face skin rashes during diet. Which diet are you talking about? I don't know. If you are developing any type of allergies or rashes which has not been noticed before, that means you are sensitive to that particular food product. So it can be because of the the basic ingredient, or it could be because of one of the preservatives in it. So you need to check which is the ingredient which is causing that. So please check out the product, and maybe you can reach out through Shalini or to us. We will, let me know if I can be of help.
Doctor, will also be any other skin rashes or urticaria? A parent wants to know if it is linked with any deficiency.
Urticaria is what we call as atopy in the body. That means there is somebody's how should they are prone to urticaria. They're prone to allergy. They will either have an IgE, there's a immunoglobulin elevated and all, and it needs to be addressed. It can be that they are sensitive to certain food items, like I said, peanut allergy, um, uh, chana dal. So many things are there. Food, even milk can cause urticaria. So you need to find out what is causing that urticaria.
And doctor, is chia seeds or flax seeds good for
Yes.
weight
Yeah.
loss?
No, the chia seed is very good because it has got omega 6. Very good. It's good for constipation also, but everything in small amount. Chia seeds are good. It's very good.
I think if people are, if somebody is getting rash when dieting, there must be some deficiency in some, vitamins, trace elements, etc. So
Could
it's
be
a,
there, but it could be,
yeah.
the first thing is that if they have started something new and they are
Ah,
developing a rash, means the first
yeah.
thing we have to do is stop that and go back. Check whatever is there and then restart one by one, and then you will know what is causing it. And usually these are common ones. So vitamin C, yeah, you can take vitamin C. You can take vitamin C in your diet. Vitamin C supplement is good. It helps with the skin. It's generally good for immunity. But remember something about vitamin B and vitamin C. They are water soluble vitamins. And if your body does not need it, it is just going to throw it out. So there's nothing wrong. But there are people, especially children, right, Indra, that who develop vitamin C,
Renal, renal issues
toxicity.
and
Yeah,
stones.
renal
Yeah.
issue, toxicity. So
Yeah.
you need to be very careful about that. Children having collage deficiency. I don't know what. Does she mean collagen deficiency? Need to take
I
protein
think
rich
so.
diet?
But we won't.
Everybody needs everybody
Everybody
needs to
needs.
have a adequate protein diet. It is not about collagen deficiency. It is collagen deficiency is not in how we don't even talk about collagen deficiency in our children unless we're talking about some autoimmune rare metabolic inborn disease. So talk to your doctors. They will be able to give you a better quality clarity on this. How to do reduce exhaustion and tiredness. I really need to go back to this. Adequate diet, sleep, proper sleep, very very important. If you start taking the right amount of protein, cut down on your carbs. The minute you cut down, I mean, I have people who say, I mean, I have patients who's come and say that after we take insulin, we are exhausted. And I said, after you take insulin, what do you take? You take food. And that food is what is exhausting you. If you take the right food, you may not need insulin. So, so it's not the insulin which is causing the tiredness. It is a food. It's a carbohydrate laden food. But what do you tell a 70, 80-year-old? Okay, you eat this much, I'll bring down the level of insulin. So that's how it works. So you need to ensure that you're eating adequate and properly.
So you have the
Alternate.
foods with that high glycemic and low
Hmm,
glycemic. So the sugar levels, it shouldn't have a spurt. Whatever
spike.
food you're giving
Yeah.
should have a spike of blood sugar, and then it drops further
Drops further.
post insulin. That's why probably
Yeah.
a person is getting tired.
Correct.
Yeah.
So not only that, so when there is a spike, they feel good immediately. And then when it comes down, and they're just adrenaline down. So yeah. Alternate milk option for lactose, you have all these plant-based milks are there, oat milk, soy, and almond. Please choose whichever.
Amul has come with lactose free.
Lactose free,
In
but
fact,
it
we give
still,
our patients.
yeah, I that is good. That is really good. But there are some people who develop irritable bowel with milk. For them, even that does not work,
Yeah.
Indra. So yeah. Multigrain bread, one bread a day or couple of bread a day for children is not really bad. Yeah, it's okay. See,
Correct.
let
They
us
need
not
their
cut.
carbs.
They love it. Like bread is staple. Like I'm saying, it is important to add the right ingredient to your meal rather than remove it from the diet completely. Anybody, and we are used to eating certain type of food. Suddenly, if you are going to remove that main ingredient from our diet, you are going to develop a lot of craving. It needs to be very slow and sustainable. Start with adding 30, 40 grams of protein in your diet, then make it to 50, 60, 80, 100, things like that. And then you will see sustainable. You don't feel you're cheating yourself. You don't feel that you have to give up on anything, and you will know how to do that measurement. It's a very big it takes time to learn anything different. It takes time to unlearn bad habits also. What are the causes of emotional eating? The emotional requirement deprivation has to be addressed. So women eat when their progesterone is high before their periods. Please ensure that you're hydrating yourself well. Talk to somebody. And once you go on a protein diet, also you need to choose. If there is a difference between eating 100 grams of protein and vegetable and a salad, then it having 100 grams of ice cream. Both are 100 grams. You are taking care of your emotional need, but what you choose to eat makes a difference. If you do not have the willpower to say no to sweets, do not keep it in front of you. Do not avoid keeping it in the house. And if somebody is gifting you with chocolates and dessert, they are not sweet. They don't like you. Give it away. You know, we need to learn to say no. So please say no.
Or distribute it.
Distribute it or give it. I mean, distributing also, you're distributing your thing, but
I
doesn't
know.
matter. Just give it away. It's not your responsibility. So, yeah. Are there any food which should not be taken together? I don't think any such thing exists. You just need to balance for better absorption of nutrients. Nothing which comes to my mind as such. But if the nutrients are all in the right quantity, I think the amount see the body decides, our gut decides what needs to be absorbed at what quantity. So protein has a certain quantity which needs to be. That's why we say you cannot take the whole protein or a carb requirement at the same time. You take more than 2 or 4 eggs at one point of time, your body will start reacting. So it is not the combination. So also let me disabuse one very big myth in our system. There is no such thing as cold and hot food. Our body is hot. Our inner core temperature is anything between 39 and 40. I'm not talking about fever. I'm talking about the inner. So anything which is going inside your body is going to become hot. So there is no concept of hot and cold food at all. So absorption depends on your body system, your gut, the microbes, the microbial diversity in your what bacteria are sitting in your gut, which is helping you with the digestion. The more diversified food you eat, the more fiber you eat, the more vegetable you eat, it helps with the gut microbiome.
Somebody had asked a question, are there any combination of foods that you shouldn't have? In fact, there are some foods that you should have together. This
Yes.
practice of putting lime, having cut the lime and keeping it as a salad when you have your meal. So vitamin C in the lime actually helps absorb iron in the
Absorb.
food.
Yes. Zinc also. So there is a very small amount of zinc in our diet in the vegetables. So when you add lemon, so it helps with vitamin C, helps with zinc also. Ma'am, what happens when iron and calcium is taken together? Nothing. The only problem with taking iron and calcium together probably is because iron causes a lot of gut issue, bowel issue. So maybe they don't, it is not. So you can try taking iron in the lunch time and calcium in the dinner time, but there is no such cross reactivity. There are a lot of supplements which come with iron and calcium together. Even in the Centrum, I'm not a big fan of Centrum because Centrum has like 30% of ingredient, that 50 component, nutritional component has got 30 to 40% of actual required ingredients. So it is not optimal.
Oh.
Or maybe around maximum is vitamin B12, which is around 500 to 1000, but the rest all are very, very trace element. But they are all coexisting. It's not really creating a big problem. So why it is like that is if they cross that level of nutritional requirement concentration, they go into the treatment approved. So they will need, they will not be OTC anymore. They will not be over the counter anymore. So it's okay. So there is no such thing. But your body may not like the calcium and iron together. So split it and take it. But you need to remember something here. People who are taking thyroid medication should not take any supplement along with that medicine. There should be a gap of at least 6 hours before you take any supplement. Thyroid has to be taken first thing in the morning, empty stomach. Any supplement has to be taken after 6 hours only because it will decrease the absorption of the thyroid medicine. That is something which needs to be remembered. What is the ideal food for an early dinner?
Early
High
dinner.
fiber.
Early
Yeah,
dinner is
avoid
good.
carbs. Yeah, avoid carbs and early dinner. There is no such thing as ideal food. Ideal food is one which has 20 grams of protein, 300 grams of vegetable, around 150 grams of carbs. This is the ideal food. You can make your own plate. There is no such thing as food which helps to prevent flu. Flu is a viral infection. It is in the air. Please take the flu vaccine at the earliest every year to ensure that you do not get flu. How to overcome vitamin D deficiency? Vitamin D deficiency is not something which is alarming. Vitamin D deficiency is something because our body utilizes the vitamin D every minute, every day. So you have to take it as a course for 8 weeks, 60,000 international unit. And then either you take it as 1,000 unit every day or you take it once a month for the next 6 months and it is okay. We don't want the vitamin D to go above more also. That is why there is a course because vitamin D excess, vitamin D is a oil based vitamin and excess can cause fits, it can cause brain problem, psychosis, and also we don't want you to take more. So it has to be between 30 and 70 at any given point of time. I think we are crossing our time. So yes, I hope it was helpful.
Very, very Shreevidya, really. And it was so simple and nice, and we could relate it to our day to day, what we consume, what we do. Shalini?
Yes, doctor, it was such a wonderful session. Like Dr. Indra mentioned, a very simple way, but everything which we could absorb very easily. I think you're like the fruit and the vegetables which we are able to observe. Your content also
Yeah, yeah, yeah.
very much.
Thank you so much, Shalini.